Now, with the reopening of schools pushed back to February due to the increasing number of COVID-19 infections, the Democratic Alliance is calling for the release of a clear and succinct plan on what the vaccination process for teachers will look like as a matter of urgency. This comes in the wake of the Basic Education Deputy Minister, Rejana Mhaule, saying during a briefing that the second wave of COVID-19 infections has adversely affected teachers and the marking of the 2020 matric exams. She added that over 3,000 teachers pulled out of the marking process, mainly because of COVID-19 related issues. For more on this, I'm joined by DAMP and Shadow Minister of Basic Education, Baxolile Nodata. Baxolile, good evening and thank you very much for your time tonight on the Newsfeed Late Night.
Good evening and good evening to all your viewers tonight.
Do you expect there would be adverse consequences to the delay in the reopening of schools to February?
The DA does not support the announcement made by the Minister of Basic Education that the reopening of schools must be pushed back to mid-February. In fact, it's left more questions than answers. You know, we strongly believe that the health and safety of both teachers and learners are very important. However, I mean, most of this work must have been done during the school holidays. I mean, they should have worked meticulously to ensure that all the necessary equipment is put in place. But secondly, after the president's announcement, you know, they had to give a very clear and succinct plan as to how this rollout of teacher vaccination will look like, especially looking at all the outbreaks in matric exam marking centers. And teachers are rightfully, you know, anxious in terms of this. And I think this pushback should have been planned much better. But at the same time, let's use this particular time to make sure that it is planned better.
Well, there are reports from the unions that there are schools that do not have still a proper implementation as far as social distancing is concerned, that don't have enough access to PPE or an emergency health plan, or even what they're going to do with those with comorbidities. Should then, because of that, those schools be delayed from reopening?
The Democratic Alliance believes that the school reopening must be facilitated through those four things you just mentioned now. That the regulations must be released by the minister to indicate when schools can open and how they should open. As indicated, they must be able to social distance, one, access to PPE. Schools that are in rural and location areas must have access to water and proper sanitation. An emergency health plan must be put in place. And there must be clear plans for those learners and teachers with comorbidities. Schools that don't necessarily meet these particular requirements should not open. However, the different districts and the provincial departments of basic education must ensure that these schools actually meet these protocols for them to actually learn, for them to open so that learners can be able to access education. Because if they don't do such, then you are creating a situation where the education system, which is unequal already, further is divided and is unequal, because most of the areas that will be affected by this are areas in poor and rural communities, where learners also depend on a school nutrition meal for them to get a healthy meal a day. So we need to ensure that these particular protocols and regulations are set out, they put in place, and these necessary schools meet these requirements for the benefit of all learners.
Right. You're calling for educators to be classified as essential service. Why?
The reason why we're calling for educators to be classified as essential services, because we see that education in South Africa constitutionally is a basic human right, access to basic education, and therefore we need to be able to fulfill that particular right. And
Right, Baxolile, I think we have a challenge there with that connection. We seem to have lost Baxolile Nodata. He is, of course, the DA Shadow Minister on Education and a DAMP. The DA calling for teachers to be classified as essential services. We'll come back to Baxolile in a moment. In the meantime, at the same time, the SABC has confirmed the death of renowned broadcaster Kabelo KB Mulopiane. The 45-year-old died this morning after a short illness. Mulopiane's radio career dates back to 1996 when he joined Motsweding FM. He hosted multiple programs including soccer, rugby and cricket commentary on the platform. At the time of his death, he was the host of Motsweding FM's weekday sports program, Mabaleng, and weekend breakfast show Lira Tabitsi. All right. Of course, Bakolile is back with us. He is the Basic Education Shadow Minister for the Democratic Alliance. Bakolile, so you were saying, sorry, before we lost you, a huge chunk of what you were saying, why you feel it is important that teachers be classified essential services?
Basically, the reason why we need to ensure that teachers are classified as essential service is because basic education, or the access to basic education, is a constitutional right. So we've got a responsibility to ensure that young people and learners of this country are given a space to be able to acquire knowledge that they'll be able to use later on as a survival kit, either to get employment, be part of entrepreneurship, innovation, but then to be able to go and work in industry. So teachers are essential in ensuring that we actually meet that constitutional basic human right. So that is why they need to be able to be categorized as essential workers. We've seen outbreaks in matric marking exam centers. We've seen outbreaks in different schools where the necessary protocols are not being met. And recently, there's been reports that over 1,600 teachers have actually passed away since the beginning of this COVID-19 virus. So it's actually essential for us to ensure that there's a proper and clear plan in place to vaccinate teachers, and they rightfully so fearful to go back to schools because there is no direct way of indicating how they're going to be vaccinated and kept safe in these schools. And that is the only solution actually we have, to get over this nightmare that we're in.
In the president's address last week, Monday, when he outlined the vaccination rollout plan, teachers would be vaccinated in phase 2. Now, I'm sure the president, or at least I'm presuming the president, is privy to this information. What do you think is the real problem here? Why would the president, with all those figures that you mentioned, with the threat of shortage of teachers, would want to put them as part of phase 2 of the rollout plan?
I think the rationale is that we need to start with healthcare workers. We're talking about doctors, nurses, support staff in our different hospitals and clinics, which rightfully so should be the case. I think the government has dropped the ball when it comes to the vaccine. It should have been acquired way before this. And there's many reports that are saying that they actually have not been engaging in good faith with the different providers of the vaccine. So that's why we're pushing out many essential workers and people that need to be vaccinated out. But nonetheless, what the DA has done is that we've called for a portfolio committee meeting on basic education to be briefed by the relevant health experts, the Ministerial Advisory Committee, and the Departments of Basic Education and Health, for them to be able to ensure that the delay in the reopening of schools was indeed based on empirical evidence, but more so than anything, to indicate to us what is the plan that is being put in place with specific timelines that are there to vaccinate teachers, so that they also know that if the safe protocols to go back to schools are being put in place, at the end of the tunnel, there is a program or a plan in place for them to be vaccinated with specific timelines.
What do you find flawed about the procurement strategy? The president is saying they have procured 20 million vaccines in a statement that he issued last week, Monday.
We strongly believe that there is some questions that we have when it comes to the president's announcements in terms of the vaccines. There is no specific timeline as to when these vaccines will be brought here. 2, there is no transparency in terms of how many doses we actually need, because we need a double dose rather than, if you're saying 20 million, in fact, we need 40 million for us to be able to vaccinate 20 million people. So there is no transparency in terms of that. Thirdly, the different types of people that they've engaged with have not given any assurances, specific timelines, how much these will cost the country for us to be able to acquire these. In fact, countries that are middle income in Southern America, in countries that are middle income that have been part of the vaccination process have acquired the vaccine way before us, which is actually questionable. And that's why our Shadow Minister on Health has actually put in a PI application to get the relevant details on this, so that South Africans actually know exactly where they stand, so that when we talk about the vaccine, we don't have expectations that the vaccine will come in the next month or 3 months in the first quarter, and then a second batch comes later on with no finer details in terms of that. That's why we need health experts, the Ministerial Advisory Committee, the departments of both basic education and health to come and brief the portfolio committee on an actual plan with specific timelines, so that
Why would you
make sure that
say
this is not going any
why
further.
would you say South Africans are being kept in the dark about the specifics of when the negotiation processes would have started? We are in a pandemic. It's a deadly pandemic. Would the officials be gambling with the lives of the people of South Africa in that particular way?
Well, we will have to find out when we get the answers to our PI application. But the reality of the situation, like me and you know, there are no specific dates as to when the vaccine will be here. There is no specific transparency as to when these engagements took place. And once that information is brought to us in terms of finer detail, clear detail to South Africans, then we'll be in a better position to then say, were they gambling with South Africans' lives or not? But in this point in time, based on where we're sitting, we have no details. We just have a detail in terms of the vaccine will come. We have no specific timelines, dates as to when this will happen. We have no specific figures as to how much this has cost the country. How much is it going to cost it further? Do we have the particular finances to do that, which I believe we do? If we stop bailing out things like SAA and focus on vaccinating South Africans. So these are the details that we do need for us to be able to find those particular answers that you're asking.
Right, Baxolile, I appreciate your time and thank you very much for joining us tonight. Baxolile Nodata, he is the Shadow Minister of Basic Education as well as a Member of Parliament for the Democratic Alliance.